In medical news tonight, a controversial new type of adoption is getting a push from the federal government.
We're not talking about adopting infants or toddlers, but embryos. The Bush administration plans to spend $1 million to encourage couples to donate their frozen embryos. Dr. Breen joins us now with the details. Doc.
Linda and Tony, this is especially controversial here. That's because in Illinois, the legal status of a frozen embryo isn't clear. You know, some states say it's a human being, others that it's property. But in Illinois, their status is in limbo, just like the embryos themselves. They've been left behind. 150,000 embryos nationwide, frozen in limbo. Rather than choose to dispose of their embryos, most couples make a difficult choice.
I think freezing is what we discussed.
But the Thomases have made a different choice. Becky Thomas is finally pregnant, and they've decided to donate their unused embryos.
If there was somebody out there who couldn't have a child, anything I could do to help.
Their doctor, fertility expert Randy Morris, arranges anonymous donations and would like to see more infertile couples get that help.
The more people that donate, the more embryos we have, the more I can satisfy the needs of those couples.
But those couples are now facing entirely new legal issues. For instance, what if the couple who donates an embryo decides years later that that child is really their own? Whose child is it? Even the experts disagree.
Legally, in Illinois, the birth mother is the mother of record. So if you deliver a baby, no matter who those embryos might have come from or whether it was donor sperm or donor egg, that mother is considered the mother.
We're not totally clear about legal parenthood with respect to embryo donation.
And embryo donors could face a different risk, that their donated embryos might one day knock on their doors.
They will bring lawsuits or make other efforts like adopted children have done in the past to find out who the legal parents are.
The Thomases say if that happens, they're ready.
I don't think that'll bother us at all.
I think it would be nice to get to know that person.
You may wonder, why would infertile couples want to use a donated embryo? The answer is to save money. A test tube baby, for instance, can cost $15,000. Embryo donation just costs about $4,000. Now, the attorney we spoke with had some interesting advice, too, for recipients of these embryos. They say receive the embryo from a couple that successfully had a child, because that couple is less likely to be frustrated, less likely to come years later and possibly claim that child.
Thanks, Doc.
It's a brave new world.